Okay, I think we can start. Hi, everyone, and welcome to this today's climate seminar. I'm Charmy Lino, and I'm project manager at Climate. Today's topic is going to be very interesting. It's about heat waves and their impacts. We're going to also have an overview on human health, impacts on human health. It's going to be very interesting. So regarding today's seminar, we're going to have Daniela Domeisen presenting her talk, Extended Range Prediction and Warnings for Heat Waves. We're going to have a brief discussion also with the participants. And then we're going to have Anna M. Vicedo-Cabrera presenting latest epidemiological research on heat and human health. First, I'm going to present to you briefly Daniela Domeisen. In her research, Daniela focuses on weather and climate variability and predictability from regional to global scales, with the goal of an improved understanding of the dynamics of weather and climate. She studies the extreme events, global remote connections, and interactions between components of the climate system using statistical tools, in hierarchy from simple to high performance numerical models. One of her goals is to successfully predict climate events to increase preparedness and to reduce impacts. So I'm going to stop sharing my screen and I'm going to leave you the floor, Daniela.
Thank you very much. Well, I'm very excited to be presenting at the climate seminar today and also to share this seminar with Anna Vicedo, who's going to present on the health impacts of the heat waves that I'll be talking about in the first place. So what we look at in our research is really the extended range prediction. By extended range, I mean anything for several weeks. So can we anticipate what's going to happen with heat waves several weeks in advance, and can we then potentially use this to make advanced warnings? So what we know already is that heat waves have increased globally. This is one of the figures from the last IPCC report. And although it's not immediately obvious, this is a world map. And all the red parts that you can see is places where hot extremes have already increased. Everything that's blue on this map is where hot extremes have decreased. And you can see there is no blue on this map. So clearly, since the 1950s, hot extremes have become much more prevalent all over the globe, except for some places where we don't have good enough data or literature yet. So this is a global threat. Things are becoming worse with heat waves. So the question that we'd like to answer is, once we know these heat waves are becoming more frequent, we might also want to predict when exactly they're going to happen. And if you zoom in on Switzerland in particular, then we can see that actually this trend is very prevalent over Switzerland as well. This graph shows one line for each year that we have. So these are average temperatures for April to September, starting in 1864. And you can see these are the average temperatures with a bit of a long tail towards warmer temperatures. And this is something I'm surprised about every time I see this plot as well. If you now overlay what happened after the 1990s, then you can see that there's been a clear shift towards warmer temperatures, warmer summers, which more or less corresponds to the actual increase in temperatures that we've had with climate change so far. And essentially what you see is that the coldest year in that modern period was even warmer than the mean of that more historical period. And also 2022 is not on there yet on this graph, but it would feature up here with 2003 and 2018, these really hot extremes that are really at the tail of that distribution already. So now, why is this a problem? This is a problem because heat waves are some of the deadliest disasters we have. But among those deadliest disasters, they're also the most predictable, much more predictable than storms and earthquakes, for example, which usually feature as the really most deadly disasters that we have. So what is the actual potential for making predictions for these events ahead of time, several weeks ahead of time, and potentially issuing warnings? So what we first do usually is try to understand heat waves, like how do they come about in the first place? Here's an example from summer 2018, where you can see this is now the average in terms of temperature anomalies. So how much were temperatures above normal during that summer? This is an average for the entire summer for June to August. And you can see that essentially the entire northern hemisphere has been experiencing very hot anomalous temperatures, essentially all of US, and then this large blob is entirely over Europe. You can see Switzerland is not even within the hottest part of these anomalies. And then, of course, what was initially less talked about, but now is becoming a huge issue with permafrost melting, is this heat wave over Siberia. So what we try to understand is how these conditions come about. We study the weather patterns that can potentially lead to these heat extremes and how they can be influenced by the underlying land and ocean conditions. And then we go into predictability. We try to understand what actually is predictable about these heat waves and how far in advance. So here's an example of how we look at predictability. So theoretically, if you just derive it theoretically, then the weather here where we live is predictable about 2 to 3 weeks. But in reality, as you know, like your Make a Swiss app usually just goes a few days to a week into the future. So the actual predictability that we have practically is often much more limited to just a few days usually. However, it depends a bit on what type of event we're looking at exactly. And for some events, there's higher predictability than just a few days. And hot extremes just tend to be one of those areas where we have higher predictability. I'm going to show you this in this plot, which I'm going to explain to you quickly. So this is the summer of 2018. So this is May to September. And these are the actual, here at the bottom, the actual temperatures that occurred during that summer. So you can see a lot of anomalous heat, so above average temperatures. What you see on the y-axis is the forecasted lead time, meaning that if, for example, 10 days before the event, we have the same color here as at the bottom, that means we already had a reasonably good prediction of what happened. And I'm just highlighting two areas here. So one was here at the end of June, where we had essentially a relatively cold spell.
Yeah.
And we had a spell as well. So essentially for this cold spell, we had a predictability, or essentially the same color here, of about 10 days. And for the hot spell, we had a predictability out to about 3 weeks. So essentially, that particular hot spell and that particular cold spell, if you compare them, the hot spell was much more predictable. But so the question was that we had, well, is this a general feature? So does this always happen that the hot spells are more predictable than the cold spells, or is this just for those particular cases? So we looked at this a bit more broadly and looked at this graph here, where we selected different regions within Europe. This one here is for Western Europe. That's the one I'm going to focus on. And we used the so-called extreme dependence index. I'm going to show you how we use this to determine the predictability. So in this graph now, everything that's on the diagonal means it's about as predictable as average temperatures. If it's to the left of the diagonal, means that in this case, hot extremes are better predicted than average temperatures. And everything to the right of this graph means hot extremes are more difficult to predict than average temperatures. And this color bar here looks at the lead time. So essentially, how far in advance can you predict something? Either 7 days or 14 days or up to a month. And you can see that essentially for all lead times, so no matter how far in advance you try to predict the hot spell, it's always essentially more predictable than average temperatures, especially here for this range of several weeks. So hot extremes always tend to be more predictable than average temperatures. And you might say, well, okay, this might just be because they're more extreme, so maybe extremes are better predictable. But we did the same test for cold extremes, and you can see that cold extremes are essentially as predictable as average temperatures, at least during summer. So the hot extremes in summer, there's really something special about this, about these extremes that makes them extremely predictable. And we can try to use this. So I want to go back to that 2018 heat wave and the peak of it, which happened here. This is the week I highlighted before, at the end of July 2018. And this is the actual anomalous temperature, so how much above normal these temperatures were here in the verification. And again, you can see Switzerland wasn't even that extreme, but it was still the most extreme summer for Switzerland in a very long time. And you might remember wildfires over Sweden and so on, but these anomalies were then essentially at the peak around 5 degrees above normal. Now, if you look at what the models predicted about 3 weeks before that event, then we can see that the models already knew 3 weeks ahead of time that there was going to be a warm anomaly, a hot anomaly in that exact region, essentially. So the region was very well predicted. However, the amplitude of the event, so how hot it was actually going to get, wasn't quite clear 3 weeks ahead of time, but it was definitely clear it was going to be much hotter than normal. So if you look at the entire evolution of how that prediction changed over the weeks before the actual event, and we look at 4 weeks before the actual event, here's the observed value that we're trying to predict. This is the anomaly of temperature, and these are the different ensemble members of that model and what they were trying to predict. So already 4 weeks ahead of the event, you can see that there's a clear tendency towards warmer than normal temperatures. So already 30% of the ensemble members already predict temperatures above the 90th percentile. And if you go closer to the event, so only just 3 weeks before the event, there's a very clear indication that we're going to have above normal temperatures. And 2 weeks before the event, we clearly see that the entire distribution just centers on the actual observed value. And the model is very sure that there's going to be a hot extreme. And there's absolutely no indication that there might be anything like below normal temperatures. So 2 weeks before the event, we were essentially certain that this event was going to happen. This is not usually the lead time at which we get or we obtain warnings about such heat events. So heat waves are indeed among the most predictable extreme weather events that we have on these weekly timescales. And even though the prediction gets worse if you go further away from the event, there's been a lot of recent papers showing that using machine learning methods, 4 weeks that are for lead times that are 3 to 6 weeks before the event. So these ML methods can actually help improve what happens or help improve the actual forecast, even at 3 to 6 weeks before the actual event. And so we compared again, just to make sure, a lot of different case studies with, we compared heat waves with cold spells, with precipitation events, with cyclones, with medicanes, and so on. Try to understand how predictable things are, and really heat waves are some of the most predictable events that we found. And this really holds globally. But the question is then, are we actually prepared for something like this? Do we actually, can we actually, once we receive such a warning or such a, heat wave prediction, are we actually prepared to do something about it? So there's two types of prediction, of course. On the one hand, a hazard prediction. As an example, Mickey Smith might tell you there's going to be heavy rainfall with the possibility of thunderstorms, or they might tell you 50% of the annual rainfall may fall in a single day, which is, of course, an extreme scenario. But then, of course, on the other hand, there's impact prediction. So what will actually happen once this rain falls, because that's always difficult to translate. So, for example, you might be told, okay, the area around your house is going to be flooded, or buildings may be destabilized in some place, which of course then is crucial information because it will determine, are you going to stay home or are you actually going to leave the area? So how prepared we are really depends on, first of all, where you are. Has your region already experienced an event like that? And also, what type of event are you expecting? Now, comparably, for heat waves, we're actually quite well prepared. For earthquakes, we're comparably also quite well prepared, but still earthquakes and heat waves are both some of the most deadly events. So, which is also one of the reasons why we have in a lot of places operational systems implemented that warn people of these extreme events. But there's other events that were even much less prepared, such as especially flooding events and storms, where there's still a lot of potential in doing this, although this might be on shorter time scales. Now, the issue is that currently we're experiencing heat waves, and we're usually just preparing for the last biggest event that we've seen, but we're living on this trend of climate change, so things are going to get worse. So we should actually probably be preparing for something that we've never really seen before, which is a very difficult task for humans. What we would actually do in this case is we'd have an actual forecast model, like a weather model like we have nowadays. We would forecast an event, and we would then compare how extreme is this event in comparison to what we've seen in the past. We would look at how extreme is it, where exactly is it going to happen. And this then has to be combined with information on exposure and vulnerability. So for example, is there, what's the age structure of the population? You're going to hear a lot about human health impacts in the second talk today. This can then be combined here in the hazard impact model, and this can then be translated into eventually warning. So what we are planning to do, and this is a project we've just started from a cross project between ETHZ and UNIL, where the idea is to look at how good are heat wave forecasts in the first place. How often do we receive, for example, false warnings or false alarms? What are the impacts that we could actually warn people about, and what is the potential for actually making warnings? We're going to focus on some of the biggest impact that we have in Switzerland in terms of different elevations, so low elevations, especially human health impacts, and at high elevations, things like permafrost melting, rockfall, and so on. You see here, there's a wide range of collaborators from EPFL, University of Lausanne, HEMISPHERE, and University of Bern. And I'd just like to highlight quickly two of the postdocs that will be working on this topic. On the one hand, Daniela, who's works on extratropical dynamics and this weekly predictability of large-scale weather, and Maria Pena, who's works on atmospheric predictability and these extreme events using a range of different methods. So, so you might hear more from them in the future on this topic. So in summary, for this talk, heat waves are becoming more frequent, more intense with climate change, but we need to actually also focus on, well, once we notice, we need to focus on when will they actually occur on timescales of weeks to months. There's a huge potential. They're some of the most predictable extreme weather events that we have. But this whole potential is not entirely used yet, in particular in Switzerland, where we can do more to warn the population about such events. And we're trying to understand how we can actually do this. So in our project, we're looking at the most prominent impacts of high alpine risks and lower elevation risks, as you'll see in Anna's talk, which will be next. So with this, I'd like to thank you very much for your attention, and I'm looking forward to your questions. Thank you.
And now I will present our second speaker of the day. So Anna Vicedo-Cabrera is an environmental epidemiologist with wide expertise in climate change and health research. She has led and collaborated in several international epidemiological studies on climate change impacts, in particular within the multi-city, multi-country collaborative research network. She has led and collaborated in research projects funded by national and international agencies. Anna, the floor is yours.
Thank you very much. Let me, okay. So do you see the screen?
Yes, thank you.
Perfect, thank you. Well, thanks a lot for the invitation and letting me contribute to this webinar series. And yeah, thanks for the kind introduction. And honestly, during the next hopefully less than 20 minutes, I'm very bad with keeping the time. I would like to talk to you about the latest research that we are conducting in climate change epidemiology on the effect of heat on human health. It's basically a way to complement what Daniela just explained. Try to understand why, of course, we know that heat waves are very relevant today, are becoming more and more frequent, and more importantly, why we need these tools in terms of warnings to predict these extreme events and try to avoid and reduce damage on our population. So to start with, I want you to bring back to what happened last summer, 2022. As Daniela just pointed out, it was a kind of very severe summer in terms of extreme temperatures in Europe, not only, and of course in Switzerland as well, but we have seen that this extreme summer in terms of record-breaking temperatures brought us as well very striking pictures as these fires that happened in London following the heat wave in July in this past summer. Again, all these together are clear demonstration of this uncharted territory that basically climate change is bringing to us. And more importantly, you might remember that this past summer was not only about heat, was about a severe drought that was affecting many parts of Europe, and as well a series of wildfires that were occurring right after these extreme events. And eventually, all these together, we know that are very important hazards for human health. So we expected that this series of events eventually would result in an extreme spike in health impacts. And actually, if you go to, I don't know if you are familiar with this Euromomo tool, it's a website that is managed by the European Union. And basically what it does is to track down or monitor excess mortality. We have been using a lot during COVID, and now it's more and more useful. And one thing is that if you go to this website and you have a look to what happened in this past summer 2022, that is basically what I'm showing here in this red square, is that actually this summer was also devastating in terms of health effects. Some people may say more, let's say mostly those that are more purist would say that it's just COVID. We know that we had the pandemic that is still going on. There are still important consequences on human health, and basically this aspect that we see happening this summer that actually in Switzerland was very severe as well. In a way, it was kind of reflection of the rise of public health measures, etc. But if you ask me, I would say that it's a kind of combination of different hazards that were going on. One side, of course, we have COVID that eventually, lead more people to be at risk, more vulnerable people affected with COVID, people with long COVID, people that eventually couldn't go into hospitals, so because they were basically overwhelmed, and eventually the chronic conditions got worse. But at the same time, thinking that all these extreme events that we have been suffering in Europe during this past summer also had an important contribution. And I leave this there, and I will come back to this summer 2022 at the end of my presentation. But overall, what we see is that heat today is an important health hazard. One side, we have estimated that it's around almost 1% of all deaths in this world can be attributed to extremely high temperatures. At the same time, we know that there is responsible for an increased morbidity in terms of hospital admissions and visits to emergency room due to cardiovascular, respiratory, and even mental disorders. And at the same time, we know that although all of us could be affected by heat, there are specific groups, vulnerable groups, that are more vulnerable, such as older adults, pregnant women, chronic patients, and children. And finally, all these together, what sometimes is very relevant for governments is that this brings very high economic costs with as well reduction of labor productivity. So let's say, to start with the basic of the story is that when we talk about heat, we talk about heat stress. This idea of heat stress comes from the thinking that in healthy conditions, the human body is able or capable to keep our core temperatures into a safe range, regardless of changes in the environmental temperature. The problem is that if these temperatures are just too high, or they are sustained during long periods, or at the same time, the individual has some conditions that eventually make that this regulatory system doesn't work properly. Eventually, these increasing temperatures would eventually, let's say, overwhelm the body by increasing the metabolic heat production and eventually triggering a series of mechanisms that could eventually damage several organs. For example, we have seen that there are changes in cardiovascular system, inflammatory processes, as well. People with patients with mental health disorders, they could also worsen their mental health status and eventually lead to an increased risk in hospitalizations. So as you could see, when it comes to heat stress, there are many, many different ways how we can be affected by extreme temperatures, high temperatures. So let's say that from a methodological point of view, we have seen that in the last years, there have been an extreme, or let's say a huge increase in research on the topic, especially starting from the summer 2003 in Europe. It was a very important turning point in terms of research and public health in this continent. We have seen that methods to try to model what is the effect of heat on human health has increased in terms of amount, but also about complexity. Thinking that the effect of heat, as I always say, in epidemiology, is very complex to assess. Thinking that on one side, we have to account for nonlinearities, thinking that we have this typical U-shape or inverse L-shape when we think about only on, let's say, this part, for example, that you can see here that represents heat. But at the same time, we know that effects of heat on human health cannot be restricted to the same day of the exposure. We have to account for some sort of delayed effect. So basically, I think it's around 10 years, Antonio Gasparini developed this method that is distributed large nonlinear models that in a way allow us in epidemiology to model both nonlinearities and delayed effects. This could give you an idea about the complexity of measured health burden attributed to heat. But as well, we have to keep in mind that also the effect of heat on human health is very much heterogeneous across populations. An example is this plot. As you could see, the typical, this is our commonly known exposure response curve across different cities, and you see that are very much different, showing that different populations have a different vulnerability, in this case for heat and cold. But it's not only about cities. I mean, of course, you can think about that, population in Spain, in Madrid are very much different, for example, the population in Sweden, but we see that even within cities and even countries, this vulnerability can be very much variable. So it brought us to basically to try to address the effect of heat on human health at very high scale, high resolution. This is an example. In this study, we modeled the whole, let's say, the effect of heat on mortality at the LSOA level in the UK, that basically is very small units, geographical units across the whole area. And we see that, for example, in Greater London, this had, let's say, the risk was very much variable across neighborhoods. But it's not only within cities, it's as well across countries. In this study, we assessed the vulnerability to heat in around, let's say, I think it's closely 1,000 cities in Europe, again, showing that the vulnerability to heat is very much variable. And on the other side, we are doing a similar assessment at a global scale. This was a paper that was published 2 years ago, in which we basically tried to model the effect of heat and cold across the whole globe, doing some sort of extrapolation analysis. In a way, again, this shows us about the complexity that when we want to assess the effect of heat on human health, we have to account for the vulnerability at very high resolution, because this, again, will very much change across population and even within small areas. But for us, the important thing is not only about assessing this vulnerability, it's as well to understand what are actually the drivers for these different vulnerability that eventually can help us to understand potential adaptation factors. So a few items we have tried to address in the past. for example, in this assessment, we compare the impact on the heat of mortality across different cities within the multi-country, multi-city collaborative research network. And in there, we saw that actually the cities that were basically more urbanized, larger, and more polluted were the ones with higher risks for heat-related mortality. But just to give an idea that, of course, we know that across cities, we have these very large differences, but in this assessment in which we use data at district level in Switzerland, on one side, we observed that actually the risk of heat was much larger in urban locations compared to rural locations, and say basically districts in Switzerland. We saw as well that the potential drivers for this different vulnerability in terms of single elements like socioeconomic status, percentage of new houses, temperature, and even pollution, in a way affect differently these different populations in terms of what are the ones, which drivers are more relevant for in terms of increasing vulnerability. Just to give you an idea, for urban districts, we saw that, for example, factors such as PM10, that is the air pollution, higher levels of PM10 in cities were associated with larger heat-related deaths. So in a way, saying that areas or cities that are larger and potentially more urbanized are those at a higher risk of heat. So let's say that we know overall that heat is very bad for us, for health, in terms of increased mortality and morbidity. But there's another element in the equation that we need to account for, is basically the role of climate change. Because we know that, okay, heat brings us this burden, but we need to know a little bit more. What is actually the contribution of climate change? So traditionally, the way how we have been doing in epidemiology is basically to address this specific research question: how much heat-related health impacts would increase in the future and the future climate change scenarios, what we call health impact projection studies. An example that I want to show you is this very recent analysis that we recently published in a preprint. It was led by one PhD student of my team, Evan Desdriver. And basically in here, we assess how much heat-related and cold-related mortality would change under different warming scenarios, under different, let's say, emission pathways and population development scenarios, what is called SSP, so shared socioeconomic pathways. And basically what we found is that under a 3-degree scenario, heat-related deaths, annual deaths, would increase from 312 to up to almost 2,000 annual deaths under a 3-degree scenario using RCP 8.5 and SSP 5. So in a way, saying that heat-related mortality would largely increase, not only because of the warming, but as well due to the contribution of the change of the population in the back. So basically, the fact that we are having more people and potentially more age, that is due to the aging, eventually would translate into much larger health impacts in the future. All this assuming current vulnerability or with no adaptation. But let's say that if we want to go a little bit further, is to say, I mean, this is about the future, but what is about the past? So say how much of the observed health burden during an extreme event can be actually attributed to human activities. And it's basically what is called today this idea of detection and attribution studies. This is actually a science that, let's say, a research area that has been very much developed within the climate science area, but not much on epidemiology. So in a say that in the past, we have seen several studies trying to say how much an event, current event that we suffer, I mean, we had in recent times, what was the contribution of climate change in terms of how much severe, how much intense, how much frequent climate change make this event. So the idea is how we do it is to compare current, let's say, climate in presence of climate change, that is basically what you see here in red, with a world without climate change. And this is the idea that eventually we compare these two scenarios. And for health, this is very much straightforward. What we do is to say how much is the burden today and how much would have been the burden in absence of climate change. So let's say just a few years ago, we had very small or very few attempts trying to quantify this this footprint of anthropogenic activities on the observed heat-related health impacts. One example was this event attribution that basically focuses on individual extreme events. In this case was led by Dan Mitchell. And basically what they wanted is to assess what was the contribution of anthropogenic activities to the observed burden during the 2003 heat wave in Paris and in London. And basically they found that in Paris it was around 70% and in London by 20%. That basically was how much anthropogenic activities increase the severity of the event in terms of mortality. Another example as well was this trend attribution analysis, in which basically what you want is not only to focus on the extreme event per se, but on the general trend in temperatures in past decades. And in this assessment in Stockholm that was led by colleagues in the University of Umeå, they estimated that actually mortality in Stockholm from extreme heat temperatures between this period was double that would have been occurred without climate change. So you can imagine about the strength of these impacts in terms of these findings. But just very recently, we within the multi-country, multi-city collaborative research network, we led this analysis in which we took data from all our network, nearly 700 locations, and we quantified that during the last 30 years, during the last 3 decades, 37% of all heat-related deaths could be attributed to anthropogenic activities. But let's say that for me, it was a kind of a turning point in my research. I thought that it was very much interesting to try to dig a little bit more. And as I said at the beginning of my presentation, coming back to the summer in 2022, we recently finished an analysis in collaboration with some colleagues of ETH and the Swiss Tropical and Public Health Institute. We quantified what was first the contribution or the impact of heat on mortality during this summer 2022 in Switzerland. Basically, we estimated that 600 deaths could be attributed to heat during this summer. That was around 3.5% of all mortality. Let's say almost double that the average heat-related burden that we expect to have every summer. But more importantly, what we did is to actually quantify what was the contribution of anthropogenic activities. And we saw that actually climate change was responsible for 60% of these deaths. As you could see, it's almost double this 37% that we estimated before in this large multi-location assessment, showing that the impact of very severe events more recently, basically it's becoming more and more larger. Let's say that the footprint of anthropogenic activities is basically expanding and being much more important in recent times. Something that as well we found that it was very relevant, it was that old women were the ones more affected by heat. And in this case, we saw that it was nearly 4% in the case of women that were more affected by heat. And as well, I think it was a little, if you do it by smaller age chunks, for about 65 years, again, were the ones more affected. So just to come back to this idea of overall, if you ask me, I would say that today health attribution studies is a hot topic. Just first because we know that it's a powerful tool for climate change policy. It would help us understand the mechanisms by which climate change affects human health, as well as would support refining projections of future health impacts, and as well improving adaptation to climate change, increase motivation for climate mitigation, thinking about the strength of these findings in terms of communication, and finally, the importance of this evidence for underpinning climate-related lawsuits. In this case, this assessment that we did in 2022 was a key finding that was considered, or let's say included, in a third-party intervention that the University of Bern as a whole we have submitted to this case in the European Court of Human Rights. Was, let's say, this Klima Seniorin case that we'll celebrate by the end of this month. And finally, it's an excellent platform for interdisciplinary research. So just to sum up, we know that in climate change, we have done we have been working quite a lot trying to clarify what is the burden of heat on human health, but still important knowledge gaps needs to be addressed. One important thing is trying to translate this epidemiological evidence into policy, more importantly related to adaptation. As well, we need to provide more reliable impact estimates. And one important topic that still remains a little bit unclear is how we can combine compound event science with health and try to provide more reliable estimates of impacts. And finally, to quantify the health burden attributed to climate change. We know that this evidence could be very much interesting and very much attractive to try to push mitigation activities in terms of communication as well, and as I said, in climate litigation. And again, all these different topics, and something that I recently discovered is that we in epidemiology, we are very much open for collaborations because we believe that all these, let's say, gaps that remain addressed, we need to work together with experts from other fields. And we think that this is a clear example of how we can work in the interdisciplinary research. Thank you very much.